let's code and enter some examples onto a claim form. The first one we're going to look at and code is basic oral evaluation. This is something that you're doing routinely in your practice, seeing patients on a regular basis for simple checkups. That's what they request. So here we have a new patient presenting on October 16th for a comprehensive exam. Patient has no complaints, just requests a complete checkup. The doctor performs a complete head and neck exam, including both extra and intraoral soft and hard tissues, evaluation of the TMD, lymph nodes, etc. An orthopanogram for bite wings are taken. There are no positive findings, and the patient is scheduled for a prophylaxis. So can this examination be billed to the medical? Absolutely. You did a comprehensive head and neck exam. The fact that there are no positive findings does not mean you can't bill the exam to medical. If you had no positive findings, would you still be able to bill the exam to dental insurance? Of course you can. So step 1, the doctor chooses the appropriate diagnosis codes and puts them in the correct order. So diagnosis A, special screening for oral malignancy of the mouth, and diagnosis B, special screening for maxillofacial cancer. Notice the short form for cancer that medical healthcare providers use. Note also that because there were no positive findings, the examination was strictly a checkup, or what is termed a screening visit. Therefore, only narrative codes are used to describe the reason for the patient encounter. Without a reason for the visit, an exam, radiographs, and any testing procedures will not be paid. And the reason in this case is for screening purposes for oral cancer, which is soft tissue, and maxillofacial, which is hard tissue, sinuses, etc. Step 2, the doctor selects the procedure codes and lists them in the correct order. So we've got the exam detailed for a new patient. Notice diagnosis pointer AB. We did the exam. We screened for oral cancer, maxillofacial cancer. Units, we did 1 exam. Then the orthopanogram, what diagnosis can be made from an orthopanogram? That's a screening radiograph. Diagnosis B, maxillofacial cancer screening. Not oral cancer because that's soft tissue. Orthopanogram can be used as a screening tool for maxillofacial cancer, and that's why the diagnosis pointer is diagnosis B, 1 unit. Diagnosis pointers for the exam point to the reason for the exam or the diagnoses that could be established from the exam. The diagnosis pointer for the orthopanogram indicates the diagnosis or reason for the screening radiograph. And we've got diagnosis B. The bite wings cannot be billed to the medical insurance as they are dental x-rays and not diagnostic for a medical problem. Therefore, you have the option of either billing to the dental plan or incorporating the fee into the orthopanogram fee. The only time dental x-rays can be billed to the medical is in cases of traumatic injury. Step 3, documentation. In this case, none required. Exams, consults, and screening radiographs do not require a pre-certification or pre-authorization. Next case, an inflamed operculum. A new patient referred by John Smith, MD, presents an acute pain from a pericoronitis in the right mandible. The patient complains of jaw and muscle pain. She was first seen by Dr. Smith on December 1st. Exam was performed in your office on December 10th, and the orthopanogram taken, which revealed a partial bone-impacted tooth that will require extraction in the future. The clinical evaluation also revealed limited range of motion, tenderness of the submandibular and sublingual nodes. Patient had an operculectomy performed using local anesthesia, was prescribed antibiotics, and will return for extraction when symptoms have subsided. So step 1, doctor chooses the appropriate diagnosis codes, puts them in the correct order. And we take the diagnosis codes. They are determined by the clinical history, the evaluation, the radiographs. So the most important problem that we're treating today is the pericoronitis. It's localized, moderate. Then we indicate this is caused by the impacted teeth. Together with that, we have jaw pain, muscle pain, limited range of motion, and localized lymph node swelling. So we order things from the most important problem being treated today down to the least important. Step 2, the doctor selects the procedure codes and lists them in the correct order. Because the patient was seen on an emergency basis and squeezed into our schedule, we indicate that first. Now notice the diagnosis pointers pertaining to this. A, D, E, and F, Units 1. Brief exam, referred patient, problem focused, A, D, E, and F. So notice that when we use the emergency code squeezed into the schedule, the diagnosis pointers are always identical to the exam that follows. Orthopanogram is listed next. What diagnosis can we make from an orthopanogram? We can make a diagnosis of B, impacted teeth, and C, what is causing the jaw pain. So we've listed our diagnostic procedures first. Exam, radiograph. Then we go to the surgical procedure. The surgical procedure is the operculectomy, and that relates to diagnosis A, the aggressive pericoronitis. Now, once we've got the procedure codes, we have to add modifiers and qualifiers. So modifier 25 is added to the CPT code for the exam to indicate that a simple surgical procedure is being done on the same day as the diagnostic exam. This applies only if the exam and consult are done on the same day as this simple surgical procedure. Without the modifier, you will not be paid for the exam. When we add the modifier to the coding, you can see that we include the Y in the EMG column for every procedure, and then we add the modifier next to the procedure code. On the claim form, you're allowed up to 4 modifiers per CPT code. Next, we have to indicate the location for the operculectomy. Was it on the right or the left side? Was it in the maxilla or the mandible? In this case, 41821 was performed in the right mandible. Therefore, the coding would look like this. 41821, modifier RT, and above it, in the qualifier section in the shaded area, we indicate the mandible JO02. Step 4, the documentation. This is a relatively simple procedure, so we want simple documentation with that, a letter of medical necessity, head and neck evaluation. These procedures do not require a pre-cert because they were done on an emergency basis. However, some plans do require that you notify them within 48 hours when an emergency surgical procedure was done. Before the next visit, which will involve the surgical removal of the impacted teeth, a pre-cert must be obtained. Why? Because this is considered elective surgery, meaning it's planned or scheduled. When you do the pre-authorization and you get that number from medical review, be sure to note the authorization number because it will be going on the next claim, on the surgical claim for the extractions. You're also going to attach the approval or authorization to the claim itself. If we look at the third example, a traumatic injury, fractured teeth, patient sustained fractured teeth in the maxilla, both central incisors, and the mandible, all 4 incisors, when she tripped and fell while running on a bike path. An exam, CT scan, and 6 periapicals were taken. All teeth are non-restorable, require extraction with the fabrication of an interim prosthesis. Extractions will be performed under moderate conscious sedation, 1 hour, and the patient has Blue Cross Blue Shield. So, here we go. Step 1, doctor chooses the appropriate diagnosis codes. Remember, any traumatic injury to mouth is the first code. In this case, the last character is an A to indicate it's the initial encounter. The next code is fractured tooth. It's an open fracture since the tooth fragments were lost. So open fracture, the last character is a B for the initial encounter. Then we indicate jaw pain, and then we indicate the narrative code for the fall. Notice all of the initial encounters have either A or B as the last character. Most of the time it's an A. The only time it's a B is if it's a fractured tooth where there is an open fracture. Next, the doctor selects the procedure codes. First, the codes for the diagnostic procedures. The new patient exam, detailed exam. We've got multiple issues going on, multiple problems. Diagnostic CT scan is done, and single x-rays of the teeth are done as well. Then the surgical procedure codes are selected. In this case, because it's Blue Cross Blue Shield, we can use the dental CDT codes. So 7210, surgical odontectomy, erupted tooth in the maxilla and in the mandible. And then the anesthesia codes are selected last. Moderate conscious sedation by the surgeon, first 30 minutes, then each additional 15. Remember, this surgery was for an hour. EKG monitoring and the pulse oximeter. And last of all, we add the interim prosthesis, both for the maxilla and the mandible. So how does that look? We add the modifier and units. And this is what it looks like. So for the diagnostic and therapeutic procedures, EMG, remember, on each procedure line, we list the exam, the diagnostic CT, the radiographs, the prosthesis. Those are the diagnostic and therapeutic procedures. Notice the diagnosis pointers. We've got 4 diagnoses for the exam. It relates to all 4. Notice also there's no spaces between A, B, C, D, no commas, no hyphens. Units 1. Diagnostic CD. What diagnosis can we make from the CT scan? And we've got that. CT scan is not for tooth diagnoses. It is for jaw diagnoses. Single x-ray of the teeth, A and B, we took 6 of those. Unit 6. And then the interim prosthesis, because the code ends in A9, we need 2 qualifiers above it. ZZ to describe the procedure, then 3 spaces and JO0102 to indicate maxilla and mandible. Units 2. For the surgical portion, your surgical odontectomies are split into maxilla and mandible. Notice the diagnosis pointers. Why are we doing the surgery? Injury to face or mouth. And diagnosis B is the fractured teeth. 4 in the mandible, 2 in the maxilla. And the tooth numbers are listed above. Modifier XS is specifically indicated and used when you change surgical sites. On claim 2, we also add in the anesthesia. So we're billing the first 30 minutes, 99144, units 1, each additional 15, so we've got 2 of those, EKG monitoring, pulse oximeter. So note that because the patient is in pain, it was a traumatic injury, that Y has to be inserted in the AMG column for each procedure line. What this does is increase the allowable benefit for the procedure. Modifier 25 was added to the exam to indicate a minor procedure is being done the same day. Modifier XS, remember, indicates a change in surgical site. When you list the surgery, highest to lowest for maximum reimbursement. The anesthesia code requires a patient status modifier. Patient was healthy, so it's P1. Notice that it's only listed on the first line, 99144, and not on the 99145 line. Then we add the qualifiers, so the JP qualifiers indicate the tooth numbers. The D codes are tooth codes, we use the tooth numbers. Then the 21089 for the prosthesis, the two qualifiers, one to describe the procedure and the second one to indicate the location. So when you look at the final claim, you can see how it would look for all other insurers other than Blue Cross Blue Shield. Claim 1 diagnostic and therapeutic procedures is the same for both Blue Cross and other insurers. However, when you look at the surgical procedure, notice how it changes for other insurers other than Blue Cross Blue Shield. We don't use a D code. We use 41899 with the explanation above it and the tooth numbers. Okay. We also add the 47 for the conscious sedation. We do not use 99144 and 145. The EKG monitoring and the pulse oximeter is reported the same for all insurance companies. Step 5, your documentation. This is a trauma claim, so we need an LMN to indicate all future possibilities for treatment, the head and neck evaluation, your operative report because it was surgery, and anesthesia record.